Hi, I'm Dr. Greg Hollstrom here at the Florida Center for Back and Neck Pain here in Largo, Florida. I'm commonly asked, what causes lower back pain? And in my clinical experience, the vast majority can be put into three categories. And that's pain arising from the spinal joint, arising from the spinal disc, and also arising from the spinal nerve, either secondary to a disc injury or a spinal syndrome called stenosis, which is a fancy medical term which means narrowing of a spinal canal or narrowing of a structure. And in this case, it's the area where the spinal nerve is trying to exit from the spine to go out to the body. Spinal joint problems are most common types of problems involving people who overdo and oftentimes lift. But frankly, when people are injured and have lower back pain, there's usually a mix of those types of problems that people bring to the office. For example, sometimes people will injure the suspension bands which hold their joint together, but they'll also have a disc tear. And they'll have mixed types of symptoms that require specific types of therapy in order to help them. People who have stenosis or narrowing of the spinal canal or changes in the spine like wear and tear types of arthritis will frequently have narrowing of their spinal canal, and other therapies are more appropriate for that. Here at the office we look very hard to try and determine what is the cause of the pain, and that is something that is often not done very well in a lot of people who evaluate spinal types of problems. But making the diagnosis in a correct way will help improve the outcome, and that's our goal for you, is to have a great outcome. And if we can't help you, we want to make sure we get you to a place where somebody can. And without a good exam and a good diagnosis, oftentimes that becomes a very difficult task. I'm Dr. Greg Hollstrom here at the Florida Center for Back and Neck Pain here in Largo, Florida.